That's why I encourage you to stay in Tacloban already. You stay in the boarding house and do not be going out, pagala-gala, going out to the mall. You just stay in your boarding house so that you will be safe there. Para bang nag-quarantine. Ganun yun. And then you're supposed to have your uniform already, right? Yeah, look at Miss Jamie Sukgang. She's beautiful. See, look at, well-groomed. Ganon kayo. Oh. Bunyales, where are you? Michael. Okay. Alcober, Narido, Garcia. Hindi open yung cameras ninyo. As much as possible, you stay in the city already. Never mind the COVID. As long as you stay in your boarding house, you'll be okay. Hindi pagala-gala. Okay? Okay. Okay. And you know, so while the child is growing up, the lungs are also still developing until the child reaches 25 years old, when the lungs reaches its full maturity. The secret here is to have long life, to have healthy life, even if you're already in your maturity, is the secret. Let your children run. Let your children play. Okay? Run around. Why? So that there will be more alveoli that will be open. Every day, more alveoli will open so that the surface area for exchange of your oxygen and carbon dioxide is greater. And these will be retained until their senior age. Not senior moments, senior, when you reach your senior age, that is 60 up. So you will still maintain the agility of your body. And you know, the activity of the brain depends on the agility of the body. So if you exercise always, the activity of your brain. Your brain is active, just like your body. Okay? So you as medical students, because there is a tendency for you to be sitting down always, right? You should have at least 30 minutes exercise every day. Going up and down the stairs or jogging in place like that. Or doing some exercise, okay? So when your child runs, more alveoli will open, and these will be retained. Even if there is diminished activity of your diminished function of your lungs for every year after 25, then by the time, if the alveoli are very much open, 100% open, so that the individual will remain active, even if that individual will already reach older, you know, senior age, 60 up. You see? So you have to encourage your children to run, because the tendency now is children will stay in front of the computers. So they will not exercise, they will not run around. So anong mangyari? Stagnant, no? The alveoli will not open because it is not all alveoli will not, it is not all alveoli that will open just like that. You have to exert work for it to open. So you have to encourage your children to exercise. And you, medical students, ang daming, so many things to read, right? Do not forget that you have to drink water and you have to exercise at least 30 minutes a day. So how do you maintain your good health while being in medical school? Aside from proper food, what food do you eat? You eat protein, fat, carbohydrates, right? It has to be varied. So you have to eat one boiled egg every morning. Take your vitamin C on a full stomach every day, 1,000 milligrams. Drink water, fresh filtered water, room temperature water, at least 12 glasses in a day, in several batches, okay? 1 or 2 gulps every few minutes, okay? And after urination, you have to replace the water by drinking 1 glass of water after urination. Then, recover your sleep during weekends. Huwag magpagala-gala. Okay? Try as much as possible to stay in your boarding house or at home because COVID is a reality. Okay? It is not in the books or in the computer only. It's real. And The problem with COVID is it's inflammatory, inflammation. So how do you overcome the inflammation? In the conventional medicine, you will have your steroids, corticosteroids as anti-inflammatory. But that is only if the inflammation is already there. How do you prevent? How do you prevent COVID? Anti-inflammatory. So you'll have to build up your immune system. Diba? So that's why you will have to recover your sleep during weekends, because it is only in sleeping that you recover your immune system. Schedule, you know, time management is important. But remember, you are 100% responsible for passing your first year in medicine. And you are 100% responsible to finish your degree, Doctor of Medicine. So, yun, take care of yourself that you will not get sick. Ang gusto pa naman ng COVID, the very low immune system. Now, and the medical students are very, very vulnerable with it because kulang ng tulog. Okay? Ang dami, so many things to read. You will have to cope up. So, yun. This, can you see this? I am already screen sharing, no? This is a summary of what happens to your oxygen and carbon dioxide. We will go back to that later. Dito muna tayo sa ano. Okay. The principles, okay? Dalton's law. Dalton's law states that in a mixture of gases, each gas exerts its own individual pressure, the so-called partial pressure. So, what are the gases in your lungs? Oxygen, carbon dioxide, you have your nitrogen, and others. The partial pressure of a gas is directly proportional to its concentration. Each gas exerts its own individual pressure. That is partial pressure. The partial pressure is proportional to the concentration of the molecules in that gas, because a gas is made up of different molecules: oxygen, carbon dioxide, nitrogen, helium, like that, no? Net diffusion of a gas occurs where from a region where its partial pressure is high to a region where it is low. That is, you know, simple diffusion. We've already taken that up. Partial pressures are denoted by a P in front of the symbol for the gas. Example, PO2 or PCO2, like that. Atmospheric or barometric pressure is the sum of all the partial pressures of the gases in the air at sea level. When you go up the mountain, your barometric pressure or atmospheric pressure will become lower. The opposite will happen if you go under the sea, okay? Deep sea diving. The barometric pressure will go higher. Air is about 79% nitrogen, 20% oxygen with very small amount of carbon dioxide, water vapor, and inert gases. So like this, PO2 of your oxygen. Notice that oxygen is only 21%. So your PO2 level at sea level is 760 times 0.21 equals more or less 160 millimeters of mercury. Okay. Your nitrogen is 600 millimeters of mercury, since it is 79% of air that we inhale. You see, it's like this. From gas phase to liquid phase. It's like this, okay? Gas and then to liquid. The molecules of the gas will dissolve into the liquid until after a while equilibrium is reached, okay? So there will be equal amount of molecules from the gases and the one dissolved in the liquid. When a liquid is exposed to air containing a particular gas, molecules of that gas will enter the liquid and dissolve in it. Just like this, okay? When a liquid is exposed to a gas, the gas has particles in it. The particles will dissolve into the liquid, will enter and will dissolve, okay? That is Dalton's law. Henry's law states that the amount of gas dissolved will be directly proportional to the partial pressure of the gas with which the liquid is in equilibrium. So the amount of gas dissolved will be directly proportional to the partial pressure of the gas with which the liquid is in equilibrium. Just like your PO2 or PCO2 or nitrogen, PN2, okay? At equilibrium, the partial pressures of the gas At equilibrium, the partial pressures of the gas molecules in the liquid and gaseous phases must be identical. That is at equilibrium already. Gas exchanges between gas and liquid phases obey the law of diffusion. So from high to low until equilibrium is reached. from gas phase to liquid phase. Henry's law also states that the amount of dissolved gas molecules at equilibrium is also determined by the solubility coefficient of the gas. How soluble is the gas? The amount of dissolved gas molecules will depend if the gas is soluble to that liquid or not, or not very soluble, something like that. Very, very soluble, or not very soluble, depending on the degree of solubility, okay? So partial pressure of the gas is equals to the concentration of the dissolved gas over the solubility coefficient of the gas. If the concentration of the dissolved gas is increased, its partial pressure will also increase, okay? And if you decrease, then the partial pressure will also decrease. If the solubility coefficient of the gas is increased, its partial pressure will decrease, and vice versa. Just like here. Partial pressure of dissolved gases are also denoted by a P in front of the symbol for the gas. So you have PO, PCO2, usually expressed in millimeters mercury units. Different gases have different solubilities. So you have different solubility coefficients. Oxygen 0.24, like that. The more soluble a gas is, the more of this gas is needed to produce a given partial pressure that can be exerted by a less soluble gas. So the amount of CO2 needed to produce the same pressure exerted by oxygen is about 20 times that of oxygen. Which is more soluble, oxygen or carbon dioxide? Oxygen. Now we will try to see, okay, the different partial pressures of respiratory gases as they enter and leave the lungs at sea level. Diba, the gases from the air will enter the lungs, okay? And then it will pass through the nose or through the mouth, and then it will go find its way into the trachea, the bronchi, until it reaches the terminal bronchioles to the respiratory bronchioles, until it reaches the alveoli area. Okay. Now, what we are considering here are the major gases of respiration: nitrogen, oxygen, carbon dioxide. Now, in the atmospheric air, you try to notice, nitrogen is 597 millimeters of mercury. That is 78%, okay? Oxygen is 159 millimeters of mercury, 20%. CO2 is only 0.3 millimeters of mercury, 0.04%. And with the atmospheric air, when it gets inside the lungs, there is also water. That is 3.7 millimeters of mercury, 0.5%. So the total atmospheric air is 760 millimeters of mercury, 100%. As soon as it gets inside the nose, it starts to be humidified. Why? Water has to be mixed to it. Can you, by the way, can you see the arrow?
Yes, Doc.
In the slide, okay. Water has to be mixed with the air. Why? So that the inhalation of the air is smooth. So that, kasi if you will inhale the air, dry air, it will dry up the mucosa of the respiratory tract, and there is pain, painful to inhale. So that to make it easy to inhale, it has to be humidified so that when it reaches the dead spaces, this will already be humidified. So the 500, you notice that the 597 now will become 563 only millimeters of mercury. And oxygen from 159 will become 149. Carbon dioxide will remain the same. Because where do you get your carbon dioxide? It's from the cells, so more level inside the alveolar area. Water, now you notice it's already 37 millimeters of mercury to get a total of 760 millimeters of mercury. Now, upon reaching the alveolar area, alveolar air now, you notice, nitrogen will become 569 millimeters of mercury, and oxygen will be 104 millimeters, and carbon dioxide is 40. Why is this 104? Because it is further diluted. Okay, and oxygen, why is this 40? Because there are plenty of oxygen, carbon dioxide from the systemic circulation, from the cells to the systemic circulation and back to the lungs. So that's why it is 40. Upon expiration, the expired air now will only have 27 millimeters of mercury carbon dioxide. But this is still very high compared to that of the atmospheric air and the humidified air. Why? Because there are plenty of CO2 in the dead spaces. Okay, so only a few millimeters of air will reach the alveoli, but there are more alveoli, CO2 in the alveolar area. And this will be diluted. So that's why it's already 27. And your oxygen is 120. Why? Because in the first place, there are more oxygen in the humidified air and from the atmosphere. And then when it reaches the alveolar air, only 104. Why? In the expired air, it has increased in level. Because there are plenty of oxygen in the dead spaces. Okay? Dead spaces, the spaces where no exchange of oxygen and carbon dioxide takes place. Okay? Upon reaching the alveolar area, what happens? The oxygen will diffuse through the respiratory membrane of the alveoli towards the capillary. Now you notice here that your alveoli is being interfolded. Why? To increase the surface area for exchange of oxygen and carbon dioxide. Okay? The lymphatic vessel of the lungs, they have a different pattern from that of the systemic lymph vessels, lymphatics, okay? Because in the lymphatics, you have your afferent and efferent, okay? So you have your entrance and your exit, whereas in the lungs, you have only your entrance and then the exit. Well, no, it's not very specific because probably the lymph vessel is already connected directly to the lungs. So the lymphatics can just drain, okay, to the different organs. So the layers of the respiratory membrane, this is considered the respiratory membrane. It is this part where the alveolar wall and the capillary wall will come in contact together, okay? So that there will be ease in the passage of oxygen and carbon dioxide. These are very fat soluble, okay? So you cannot notice the passage of oxygen and carbon dioxide. So the first layer of fluid lining the alveolus containing surfactant. This is the first layer. It is a layer of fluid lining the alveolar surface, and it contains the surfactant. Okay. What does your surfactant contain? The majority is dipalmitoyl phosphatidylcholine. So from there, you have your alveolar epithelium, this one. It is composed of very thin epithelial cells. Then you have your epithelial basement membrane. This is your basement membrane. Okay. And then from the epithelial basement membrane, you have your interstitial space. That is the space between the alveolus and the capillary. Very thin interstitial space between the alveolar epithelium and capillary membrane. Then you will have your capillary basement membrane. So you're already on the other side, okay? From the basement membrane of the capillary, you have your capillary endothelium, okay? And that's it. And then you'll have your plasma, and then you will have your red blood cell. The oxygen will find its way, will diffuse from the alveolar area towards the capillary, passing through the plasma and then going into the red blood cell. The thickness of the respiratory membrane is only 0.6 micrometer, but the total surface area is 70 square meter. If you spread it, it can cover 1 tennis court. So that is really designed for man to be able to supply oxygen towards the cells, trillions of cells in the body. So the total amount of blood contained in this area is only 100 ml. You can just imagine, yeah? But the exchange is very fast. So, and in return, your carbon dioxide from the red blood cells will go to the plasma and then go towards the alveolar area. So they exchange, okay? Because there are more carbon dioxide from the cells, tissue cells, okay? Now, factors that affect the rate of gas diffusion through the respiratory membrane. One is the thickness of the membrane. It is only 0.6 micrometer, so that means it is very thin. But you know, if something goes wrong, the respiratory membrane can thicken. And so you can just imagine if this will thicken, so the lungs will become stiff. And so the oxygen and carbon dioxide cannot pass through easily. And also another factor is the surface area of the membrane. As I mentioned earlier, your alveoli is interfolded to increase the surface area for exchange of oxygen and carbon dioxide. Now, for every fold of your alveoli, of your alveolus, there is a corresponding capillary that lie beside it. it is always accompanied with a capillary, because it is the capillary where that supplies the blood, okay? And it is in the blood that the red blood cells are found, and it is in the red blood cells that the hemoglobin is found. And it is where the oxygen will combine, okay? So the surface area of the membrane, if this is damaged, what will happen? So the surface area will decrease, okay? So the amount of oxygen that will exchange is already also decreased. You can just imagine, if you are sick with emphysema, what happens to the alveolar walls? It is damaged. So instead of it being interfolded, this will just go straight. Wala na itong interfolded. This will just go straight. And so the amount of oxygen that is supposed to be going to the systemic circulation is decreased, okay? The diffusion coefficient of the gas in the substance of the membrane also affects. If the gas is very soluble, it can easily pass through. If it is not as soluble, it can still pass through, but the amount of pressure that it will produce is already greater than when the gas is very soluble, okay? Partial pressure difference of the gas between the two sides of the membrane will also will affect the rate of gas diffusion through the respiratory membrane. Of course, you have more oxygen in the alveolar area and more carbon dioxide from the capillary area. So since you have more oxygen in the alveolar area, more oxygen will diffuse through the respiratory membrane towards the capillary and towards the red blood cell. And carbon dioxide also from the capillary will diffuse towards the alveolar area of the lungs, okay? Because there is higher concentration of carbon dioxide from the plasma of the capillary. And then, so it will find its way into the alveolar area and towards the outside. And also, likewise, the oxygen from the alveoli, it will find its way into the plasma of the capillary of the blood, and then it goes into the red blood cell and to the hemoglobin, where it binds with iron and it is brought into the tissue cells, okay? Diffusion rate. Diffusion is proportional to the change in pressure times area times solubility over the distance of diffusion times the square root of the molecular weight of the gas. That is how you determine the diffusion rate is proportional to the change difference between the partial pressures times the cross-sectional area of the diffusion times the solubility of the gas. over the distance of diffusion times the square root of the molecular weight of the gas. This is how you compute the diffusion rate. So that if you have plenty of oxygen in the alveolar area, but you have plenty of oxygen here and less oxygen in the hemoglobin, in the blood. So what happens? The diffusion is from the alveoli towards the blood, okay? Because there is a big difference in the pressure. And if the cross-sectional area for diffusion is big, then diffusion rate is faster. And if the gas is very soluble, then diffusion rate is also faster over the distance. So inversely proportional is the distance. So this is what happens. We will consider the air, oxygen from the air, okay? And carbon dioxide. So as it goes to the alveoli, the air from 160 millimeters of mercury concentration, because it is being humidified, it is diluted by water. And so when it reaches the alveoli, it is only 105 millimeters of mercury. Whereas the oxygen, PCO2, is 40 millimeters of mercury because it comes from the lung capillaries, okay? So the oxygen, once it reaches the lung capillaries, is also diluted farther. So it will now become only 100 millimeters of mercury. And the PCO2 will be still 140 millimeters of mercury. Of course, that is from 46. Okay, so that is 40. And this will find its way through the left ventricle of the heart, through the pulmonary veins, and to the left ventricle of the heart, to the aorta, to the systemic circulation, systemic arteries, and will find its way into the tissue, capillaries, and towards the cells, okay? Now you notice that of the 100 millimeters of mercury, that's what they call, it's better to be oversupplied than undersupply, okay? So that's why you notice that the supply of oxygen here is very high, millimeters of mercury, 100. When it reaches the cells, the oxygen is only 40. Only 40 will find its way into the cells. And out of the 40, the mitochondria will only utilize around 5 millimeters of mercury. Just imagine, only 5 out of the 40 and 40 out of the 100. Imagine. But nature has so designed the body that he has supplied so many mitochondria. How many trillions of cells? 300 trillions of cells inside the body. So it compensates the quantity compensates for the small amount that the mitochondria will use. And out of the 5 millimeters mercury oxygen utilized by the mitochondria, so there is metabolism there. And so the product of metabolism is carbon dioxide. It produces 46 millimeters mercury of carbon dioxide inside the cells. And this is the one that goes out of the cell and find its way into the systemic circulation. This time, it goes through the systemic veins, okay? And so, your oxygen is still there, 40 millimeters of mercury. Sorry. Still, kasama siya. And it finds its way into the right heart, systemic veins to the right heart, and to the pulmonary arteries. Your pulmonary arteries, the blood there and the pulmonary arteries is they consider it unoxygenated blood. But actually, in reality, it's not really unoxygenated because there is still 40 millimeters of mercury oxygen. Okay? So, it's find its way into the lungs, lung capillaries, and then to the back to the lungs. The CO2, since it is higher, 46 millimeters of mercury, higher than your oxygen, so it finds its way easily, more diffusible towards the alveolar area than the oxygen, because the oxygen has higher level in the alveolar area, so it finds its way into the lung capillaries and exchange for the carbon dioxide. Okay, and so the process will repeat. It is like that, okay? So, effects of various conditions on alveolar gas ventilation. So, if you, for example, you are breathing air with low oxygen, low PO2, what happens to your alveolar oxygen? Of course, it decreases. Your alveolar PCO2, no change, because your CO2 comes from the cells. How about if you increase your alveolar ventilation, but metabolism is unchanged? So that means if there is no change in metabolism, the production of CO2 is the same, okay? So increase alveolar ventilation, that means increase in PO2. Okay. Why is there decrease in PCO2? Because increase alveolar ventilation, you increase oxygen utilization, okay? Why is there increase in PCO2? Because you increase the respiratory rate. So the amount of CO2, more CO2 will be brought outside, okay? That's why if you would like to have a resistance, for example, in running, you will have to hyperventilate first, okay? And then if there is decrease in alveolar ventilation, so what happens to the PO2? It decreases because ventilation, alveolar ventilation is decreased. And the metabolism is unchanged. The metabolism inside the mitochondria, inside the cell, is still the same. So still there is production of CO2. So what happens to the alveolar CO2? It will increase. So more CO2 is still produced and brought to the alveolar area. So PCO2 is increased. So, and if you increase your metabolism with unchanged alveolar ventilation, what happens? Your alveolar PO2 is decreased. Why? Because you increase your metabolism. So that means increased usage of oxygen. So your PO2, alveolar PO2, will decrease, while the alveolar PCO2 is increased. Because increased metabolism produces more CO2, okay? Now, alveolar ventilation with unchanged metabolism. Is this correct? Decrease alveolar ventilation, unchanged metabolism. When you say you have unchanged metabolism, that means is this correct or wrong? Supposed to be like this, okay? Hindi ganito. Are you with me? Walang sound.
Yes po daw.
Yes. So which is correct? The one up or the one below? You have decreased alveolar ventilation, unchanged metabolism. Yes, the up is the correct one. Hindi ito. This is purposely placed here because pag face-to-face kayo, if we are in the classroom, if the discussion is already very technical, the tendency is magduka. You'll be sleepy. So to wake you up, ilalagay ito dito to find out if the students are following you or you are thinking. Okay? So we will proceed. Proportional increase in metabolism and alveolar ventilation, if they're equal, so no change. Okay? Do you follow so far? Ay, ano ba ito? So you notice here, this one, This is alveolar ventilation. If you plot it, alveolar partial pressure with alveolar ventilation, you notice that if you increase your alveolar ventilation, the amount of oxygen will also increase, okay? And if you increase your alveolar ventilation, the amount of carbon dioxide will decrease, okay? Because you put out more CO2 outside and you use more oxygen, okay? So the alveolar PO2 increases as alveolar ventilation increases up to a ceiling of 149 millimeters of mercury. The alveolar PCO2 increases directly in proportion to the rate of carbon dioxide excretion. Alveolar, remember, if there is more production, increased metabolism, more production of CO2, so increase alveolar in the alveolar area PCO2, okay? Second, the alveolar PCO2 decreases in inverse proportion to alveolar ventilation. The alveolar PCO2 increases directly in proportion to the rate of carbon dioxide excretion. If the excretion of your CO2 is decreased, so alveolar PO2 will decrease. If you increase the alveolar ventilation, the amount of PCO2 will decrease, okay? Because you put out more oxygen towards, CO2 towards the outside. Okay. We're done with that. And so, concept of ventilation perfusion ratio. You know, for every alveoli, for every alveolus, there is a corresponding capillary that lies side by side with it, okay? So normal gas exchange requires that ventilation and perfusion of the alveoli are correctly matched with each other. Kailangan, if there is ventilation, if more air is brought from the outside to the alveoli, more blood should be supplied to that particular alveoli for the oxygen to be carried away towards the cells, okay? If an alveolus is well ventilated, it must also be well perfused. Perfusion, blood supply. If it is poorly ventilated, the blood flowing in it should also be reduced accordingly, or else there is a ventilation perfusion inequality. And we call that as your, it is expressed as your VAQ. In between, so your VAQ ratio is either 0 or infinity. In between these two extremes, VAQ is less than normal. If VAQ is less than normal, so poor ventilation. The normal value here is 0.8. So there is a physiologic shunt. If VAQ is greater than normal, there is poor perfusion, poor blood supply. So there is physiologic dead space. So the ventilation at this point is wasted because it will just stay in the alveolar area. It will not be carried away by the blood towards the tissues. So for example here, unventilated perfused alveolus. So what happens? The oxygen is only 40 millimeters of mercury, whereas the CO2 is 46 millimeters of mercury. So no ventilation, unventilated. But there is, okay, we're done actually. So there is perfusion. So that's why the CO2 is being brought to the alveolar area, but no oxygen from the alveolar area that exchanges the CO2 towards the systemic circulation, towards the capillary, and eventually to the systemic circulation. So this is unventilated, but perfused, unventilated perfused alveolus. The value here is 0. VQ equals 0. Always bear in mind, O0 is oxygen, okay? And so if this is 0 oxygen, unventilated, always remember this. If it is ventilated, and perfused, this is the normal. It should be balanced. There should be ventilation and blood supply, perfusion. So 100 millimeters of mercury of oxygen from 104 in the alveolar area. In the systemic circulation, it is only 100 millimeters of mercury because it is being diluted by the plasma. And the CO2 from the capillary will be brought to the alveolar area. So 40 millimeters of mercury, still 40 millimeters of mercury. And so what happens? Ventilated and perfused alveolus. There is balance. This is the normal. If it is unperfused, you have 0 blood flow. The value here is infinity. Unperfused alveolus. So you notice that the amount of oxygen in the alveolus is already very high. Whereas that of CO2 is very low because there is no blood supply at this time. So to that particular alveolus, so the value is already infinity. Unperfused. The oxygen cannot move to the systemic circulation, and the CO2 cannot go into the alveolus. So it will remain very low. Unperfused, ventilated, but ventilated. Whereas here in the extreme, on the other extreme is unventilated, rate, okay, but perfused. You should take note of this. Remember, and you have to memorize that. We're already at the end. At a constant temperature, the amount of a given gas that dissolves in a given type and volume of liquid is directly proportional to the partial pressure of that gas in equilibrium with that liquid. An equivalent to the law is that the solubility of a gas in a liquid is directly proportional to the partial pressure of the gas above the liquid. Okay, you have to remember this. I would like to acknowledge Dr. Arturo Gogo, the former chairman of the department. He is the one who supplied these slides. And that's why I will give this out to you, because that is what he likes. That I always give out the slides to the students so that you can use it in so many ways, okay? You can either, later on, so this is supposed to be, shall we say, your basic, no? Later on, with the change, with research, we have newer editions of the book and new knowledge. So later you can revise, add or minus the things, the principles you have already mastered. You have reached to the level of automaticity. It cannot be erased from your brain memory, okay, from your brain computer. It has already reached the level of automaticity. So then you can erase that from here, from your slides, and then replace it with a new knowledge. So this is your basic. This will arm you until the time you will take the board exam. So that's why it is important that you treat every exam as board examination. It is not an ordinary examination. That's why we designed, you notice that during the exams, ours is multiple choice, okay? A, B, C, D. And then the APMC, before we used to have A, B, C, D, E. But APMC has revised the questions. That's supposed to be the choices will only be up to A, B, C, D. And so now you notice that our choices is already A, B, C, D. Okay? And you have to take note of that. So you have to get used to the type of exam, and you have to get used how to choose the best answer. Because you have to, what do you call this? You have to analyze. You have to analyze which is the best answer. So that even if the exam is a problem, the question, for example, it needs to be solved using a draft paper, the choices is already there. So that means you can have a draft. You can, if it is face-to-face, we allow the students to write at the back, use it as a rough draft. And then from the choices of the answer, you can already answer which is the right answer. Okay? Do you have any question? Wise or otherwise? Pwede rin otherwise. Pwede rin. What else? Yes. wise or otherwise. If you have any doubts, any queries, anything which you think I can mentor you, feel free to ask. You can unmute anytime. You can even interrupt me during my lecture. I allow that. And so, since we are done and it's still early, I like, since we already have groupings, right? I would like to assign you already your different cases of respiratory insufficiencies, so that, you know, this is a group work, so that you will be able to work on it. Of course, but of course, you still have to study for the exam tomorrow, right? Huwag mo na ang ano, just the title ba lang. I will just give you the name of the condition, and then it is up to you when you will work on it. But be sure that it will answer the one I placed there in the koan. When, where, I will shift this, okay? Okay, so tomorrow you will have an exam, a quiz, okay? So you will start reporting on the 18th after our short quiz on the 13th. So you still have time from the quiz. You still have time to work on your cases and start reporting on Monday. What is your pleasure? Would you like to have a raffle? Who will start? Or would you rather we start with group 1 up to 10? What is your pleasure? What do you like? Who is your president? Or your coordinator?
Ikaw na lang po ata, Doc. Bahala if you like.
Okay. If I am the one to decide, then you will start from group 1 up to 10. Or, yes, ganun na lang.
Okay,
And
po,
then,
Doc,
but
noted.
then, the cases will have to be ruffled off, okay? So bukas na lang after the
Quiz.
After the quiz, okay? We will have the raffle. Who will get asthma, bronchitis, like that, emphysema, okay?
Okay po.
So, yeah, so that you can spend the rest of the morning studying for your quiz tomorrow. So remember, you are 100% responsible for your passing the quiz, okay? So, do not take this exam for granted because this will push you up. And remember, you only 40 passed the exam last bi-monthly, and that is a major exam. So you need the scores for your quizzes to push you up in your second bi-monthly exam, okay? So, immunohematology, whatever Dr. Abueva mentioned, surely that will come out in the exam. Just like Dr. Mambulaw, you have to take note what things he mentions, because that is his favorite. So he will surely mention that in the exam. Okay? So we are done for this morning.
Doc, what time po yung quiz tomorrow? 10 a.m. po ba?
What would you like? The official time is 10, but you can have it earlier if you like.
The schedule na lang po.
As scheduled, okay.
Thank you.
So it is 10 or 10:30. It depends.
Already said it at 10, Doc.
Ha?
Sasha here.
Ha?
Set na na 10.
Ano?
Iset na na ako. 10.
Okay.
10. So
10.
now,
So,
I will publish ko na.
So the link will already be given the day before.
Yes, Doc.
Okay. Very good siya. So, yun na. Yun. If you don't understand anything, feel free to ask. We are here to help you. We are not the boss. We are your mentors, your coaches, your teachers. Okay? Feel free. Para bang, because you have to consider it is in the attitude of the student. Because probably during our elementary, like me, for example, during my elementary days, the teachers were already very, very strict like that. And later, they found out that's not very, very conducive to learning if you are too strict with your students. So you act as a coach, not as the boss, because each individual has different capabilities and talents. That's why if you think you are deficient on these different aspects, you have to double time. For example, the medtechs, these are review things for them. So madali lang para sa kanila. They don't have to spend much time. But if you are BS Bio, this was not your life. Whereas the medtechs, these were already their life during the first degree schooling. And so, mag-double time kayo so that you can cope up. Now, do not be afraid to commit mistake, because that is where you learn. You have to remember, next time, talagang ito na ang answer. Because there is a tendency for the questions to be repeated, especially if they're important, and only few were able to answer that particular question. Because we also do, analysis, item analysis. Okay. That is all. We're done. Pwede mo na i-end siya.
Thank you, Doc.
Bye, Doc.
Thank you, Doc.
Thank you, Doc.
Okay.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Tomorrow we'll start at 10. That means,
Doc, may naman yung question.
huh?
The chat box, Doc, does exercise also helps in asthma patients?
And the ano?
Does exercise also helps in asthma patients?
Exercise?
Yes.
Ang kailangan, ang kailangan niya ay ano? Yung exercise for the lungs. There is an exercise for the lungs. And the best exercise for the lungs is swimming. Not necessarily swimming like the athletes, but submerging yourselves up to the chest. Because you'll be forced to inhale and exhale like that. It depends on the status of the patient. I will tell you about that later, pag mag-report na kayo. During your reporting, we will discuss things thoroughly during the report. Okay? Bakit? Sino bang asthmatic sa inyo? Plenty kayo? Asthma, that is an allergy, and then that reflects on the status of the liver.
Okay.
You do some liver detox. Yes, you do some liver detox, and asthma will just go away. I will teach you how to do some liver detox. You like that? Pero may exam pa kayo. Sa ano na lang? Bukas, after the exam. Okay? Yes, tomorrow. Just remind me, okay? Sige. You can leave now. Have an early lunch and study. Huwag pagala-gala. May COVID sa labas. Hindi na. Hindi ako mag-leave. Kayo. Kayo ang mauna.
Doc, thank you.
Sige.
Thank you, Doc.
You are always welcome. Oh, si Sha na. Ikaw na ang mag-ano siya, ha? Mag-off.